Hey guys, Seth Peterson here to talk about a study we recently had published in Musculoskeletal Science and Practice about how people with lumbar spinal stenosis make decisions about treatment. So this is kind of a timely topic. At the current time, we really don't know whether it looks like there's no superiority between surgical and non-surgical treatment for this condition, yet surgery has risen in terms of how often it's being performed recently. So we thought it would be important to ask people what they thought about that and how they made those treatment decisions. This was a question that was actually prompted by patients, and we ended up having patient involvement throughout the course of this study. In the end, we ended up having 12 people with lumbar spinal stenosis. Half of them had surgery for their condition, and half of them did not have surgery for their condition. So we ended up finding that how they made decisions pretty well followed the health belief model, which is a model that's been used to kind of reflect how people make decisions about health for decades now. It's been used sparingly for surgery, but it looked like it reflected that pretty well in this study. And so the people that ended up having surgery for stenosis overall saw themselves as more susceptible to surgery, oftentimes because of pathoanatomical beliefs about lumbar spinal stenosis. They also had a lower feeling of control over the treatment decision itself and also over their symptoms. So if you think about that, they really had these pathoanatomical beliefs, and then they found that they couldn't really control the symptoms, whether it be with exercise or with activity modification. So they felt like the decision was already made up. Surgery was the right decision for them. So those were the primary findings in the study. One of the key barriers that we did find was that previous experiences in physical therapy weren't always the best for the people that were in the study. So pretty interesting findings. If you want to dive more into the research, we recommend you go to Musculoskeletal Science and Practice's website and download the paper and read it and let us know what you think. All right, take care.